In today's video, you're going to learn about the 5 common vitamins that could be increasing your stroke risk and potentially harming your brain health, especially as you age. If you're a senior or caring for one, you'll want to know how these vitamins might be silently increasing your risk. We've spent hours researching and analyzing the latest health studies, and we've spoken with top medical experts to bring you only the most accurate and up-to-date information. These are the same vitamins we've discussed with healthcare professionals, and today, we'll share why they're so important to get right. So, stick around, because today, you're not only going to discover the dangers of vitamin E, vitamin A, vitamin K, folic acid, and vitamin B6. But we'll also explain exactly how to manage these vitamins in your diet to reduce your stroke risk. Plus, we'll cover some surprising facts you probably didn't know about common supplements and how they can affect your brain health. Number 1. Vitamin E. Vitamin E is known for its powerful antioxidant properties, which help protect the body's cells from damage. It's commonly used to support skin health, reduce inflammation, and boost the immune system. However, while vitamin E is beneficial in moderation, taking too much can have serious risks, especially for seniors. When taken in high doses, vitamin E can act as a blood thinner, making it harder for blood to clot. This can lead to increased bleeding, and in some cases, even strokes caused by bleeding in the brain. For older adults, this is particularly concerning because they are already at higher risk for heart disease and stroke. Studies have shown that consuming excessive vitamin E, more than the recommended daily dose of 15 milligrams, can significantly raise the risk of hemorrhagic strokes, which happen when blood vessels in the brain rupture. The risk of bleeding is even higher for seniors who are taking blood-thinning medications like warfarin or aspirin. These medications already reduce the blood's ability to clot, and adding high doses of vitamin E can increase the chances of dangerous bleeding complications, including stroke. The recommended daily intake of vitamin E for adults is about 15 milligrams, and the safe upper limit for supplementation is 1,000 milligrams per day. This is much higher than what people usually get from their diet. It's important to avoid exceeding this amount unless specifically advised by a healthcare professional. While vitamin E is found in many healthy foods like nuts, seeds, and vegetable oils, seniors should be cautious about taking extra vitamin E supplements, especially in high doses. It's always a good idea to talk to a doctor before starting any new supplement, particularly if you have health conditions or are on medications that affect blood clotting. Number 2. Vitamin A. Vitamin A is essential for maintaining good vision, supporting the immune system, and promoting healthy skin. It's found in foods like carrots, sweet potatoes, and leafy greens. While vitamin A is important for health, taking too much, especially from supplements, can increase the risk of stroke, particularly for seniors. Vitamin A is a fat-soluble vitamin, which means it's stored in the body. While this is beneficial, it also means that excess amounts can build up over time, leading to toxicity. Too much vitamin A can weaken blood vessels and increase the risk of bleeding, which can result in a hemorrhagic stroke. Research has shown that taking excessive vitamin A over long periods can damage the cardiovascular system, increasing the risk of stroke in seniors. Unlike getting vitamin A from food, it's much easier to consume dangerous amounts through supplements. The body doesn't easily eliminate excess vitamin A, which can lead to harmful effects like liver damage and increased bleeding risk. For seniors, high-dose vitamin A supplements can heighten the chance of stroke and other heart-related issues. To avoid the risks of vitamin A toxicity, it's essential to stick to the recommended intake. For adults, the daily recommended amount is 700 to 900 micrograms, and the upper safe limit is 3,000 micrograms per day. It's generally best to get vitamin A from natural food sources rather than supplements, unless advised by a healthcare provider. Number 3. Vitamin K. Vitamin K is crucial for blood clotting and bone health, playing a key role in preventing excessive bleeding. It is found in foods like leafy green vegetables, broccoli, and fish. While vitamin K is essential for these functions, taking too much of it, especially in supplement form, can be harmful, particularly for seniors who are at an increased risk of stroke. Vitamin K helps regulate blood clotting by activating certain proteins in the blood. This is normally a good thing, as it helps stop bleeding when needed. However, the issue arises when seniors take high doses of vitamin K supplements, particularly those already on blood-thinning medications, such as warfarin. Vitamin K can interfere with these medications, making them less effective, which increases the risk of dangerous blood clots. While vitamin K from food is usually not a concern, supplements can cause problems. Seniors who are on anticoagulant medications need to carefully manage their vitamin K intake. Sudden spikes in vitamin K levels, often caused by taking supplements, can disrupt the delicate balance required for these medications to work properly, increasing the risk of both clotting and bleeding, including stroke. For seniors taking blood thinners, it's important to maintain a consistent intake of vitamin K to ensure the medications work effectively. Too much or too little vitamin K can be problematic. It's generally best to get vitamin K from food sources rather than supplements, unless directed by a healthcare provider. Foods like spinach, kale, and cabbage provide vitamin K without interfering with medication when consumed in moderate, consistent amounts. Number 4. Folic acid, vitamin B9. Folic acid, also known as vitamin B9, is an essential nutrient that plays a vital role in cell growth, brain function, and red blood cell formation. It is particularly important during pregnancy and for preventing birth defects. Folic acid is found in foods like leafy greens, beans, and fortified grains. However, when taken in excess, particularly through supplements, it can pose risks, including an increased chance of stroke in seniors. While folic acid is crucial for health, too much of it can mask a vitamin B12 deficiency, which can lead to neurological problems and cognitive decline. In seniors, a B12 deficiency can result in nerve damage and memory issues, which indirectly increase the risk of stroke. High doses of folic acid can also cause an imbalance in homocysteine levels, an amino acid linked to a higher risk of cardiovascular disease and stroke. Elevated homocysteine levels are considered a risk factor for stroke, as they can damage blood vessels and increase clotting. The recommended daily intake of folic acid for adults is around 400 to 800 micrograms. But exceeding this amount, especially through supplements, can be harmful. Seniors who take large doses of folic acid might unknowingly cover up signs of B12 deficiency, which can lead to serious neurological damage. Furthermore, excessive folic acid can increase homocysteine levels in the blood, further elevating the risk of heart disease and stroke. For most people, the best way to get the necessary amount of folic acid is through a balanced diet rich in natural sources like leafy greens, beans, and fortified foods. Seniors should be cautious with folic acid supplements and only take them if recommended by a healthcare provider. It's essential to avoid high-dose folic acid supplements unless needed, as this could lead to the hidden risk of a B12 deficiency and a higher likelihood of stroke. Number 5. Vitamin B6. Vitamin B6, also known as pyridoxine, is an essential nutrient that plays a critical role in brain development, nerve function, and the production of red blood cells. It helps the body convert food into energy and is involved in the production of neurotransmitters, which are essential for mood regulation and cognitive function. While vitamin B6 is necessary for good health, excessive intake, especially from supplements, can increase the risk of stroke in seniors. Vitamin B6 is water-soluble, meaning that any excess is usually excreted from the body. However, when taken in large amounts over a long period, vitamin B6 can build up and cause toxicity. High doses of vitamin B6, particularly above 200 mg per day, can lead to nerve damage, resulting in symptoms like numbness, tingling, and difficulty walking. This nerve damage, known as peripheral neuropathy, can affect the brain and nervous system, potentially leading to cognitive decline. When nerve function is impaired, the brain becomes more vulnerable to damage from other health conditions, increasing the risk of stroke. The recommended daily intake of vitamin B6 for adults is around 1.3 to 2.0 milligrams. But excessive use of vitamin B6 supplements, particularly in high doses, over 100 milligrams, can cause serious damage. For seniors, who may already be dealing with age-related cognitive decline or other health issues, the risks associated with high doses of vitamin B6 are more concerning. Did you know that a stroke can occur suddenly, often without any pain or clear warning, especially in older adults? For seniors, even the most subtle symptom could be the first sign of a life-threatening emergency. Unfortunately, many people ignore or misinterpret these signs, thinking they are simply part of aging or fatigue. But the truth is, recognizing the early signs of a stroke and acting fast can mean the difference between a full recovery and permanent disability or even death. If you're over the age of 60, or if you're caring for a senior loved one, this video could genuinely save a life. So, make sure you stay with me until the end, because what you learn today could make all the difference tomorrow. And if you find this kind of health information helpful, don't forget to subscribe to our channel for more life-saving tips every day. In today's video, we're going to take a closer look at one of the most serious and time-sensitive medical conditions affecting older adults, stroke. Specifically, we'll be discussing the early warning signs of stroke in seniors because when it comes to stroke, every second counts. The sooner the symptoms are recognized, the faster medical help can be provided, which greatly improves the chances of survival and recovery. So, let's get started by breaking down the 6 most important warning signs of stroke that you should never ignore. Number 1. Sudden numbness or weakness. One of the most common and serious warning signs of a stroke is sudden numbness or weakness, especially on one side of the body. This can affect the face, arm, or leg, and it often happens without any warning. For example, a person may not be able to lift one arm, or their smile may appear uneven because one side of the face has drooped. The weakness might feel like the limb has become heavy or hard to move, and the numbness may feel like the area has gone to sleep. This happens because a stroke reduces the blood flow to the brain, and the part of the brain that controls those muscles can stop working properly. When that happens, the body part connected to that brain area also stops working the way it should. That's why sudden weakness or numbness, especially if it's only on one side, is a red flag for stroke. If you notice this happening to yourself or someone else, do not wait. Call emergency services immediately, because fast treatment can save the brain from permanent damage. Number 2. Confusion or trouble speaking. Another serious and common warning sign of stroke is sudden confusion or difficulty speaking. A person who is having a stroke may find it hard to speak clearly, understand others, or even process simple information. For example, they might suddenly stop in the middle of a sentence, use the wrong words, or say things that don't make any sense. Their speech may become slurred, slow, or jumbled, even though they were speaking normally just moments earlier. This happens because a stroke can affect the language centers of the brain, especially on the left side, which control how we speak and understand words. It can feel frustrating and scary for both the person experiencing it and those around them. You might notice they can't follow a simple conversation, give strange answers, or look confused when spoken to. It's important to understand that this is not normal forgetfulness or aging. If this kind of confusion or trouble speaking comes on suddenly, it should be treated as a medical emergency. The faster a stroke is identified and treated, the better the chances are of recovery and preventing permanent brain damage. So if you see these signs in yourself or someone else, don't wait, call for emergency help immediately. Number 3. Sudden vision problems. A sudden change in vision is another important warning sign of a stroke, one that people often overlook. A person having a stroke may suddenly experience blurred vision, double vision, or even loss of vision in one or both eyes. This can happen very quickly, without any pain or warning. They may say things like, "It feels like a curtain came over my eye," or "Everything looks blurry or dark." This happens because a stroke can affect the areas of the brain that control sight. When blood flow to these parts is blocked, the brain cannot properly process what the eyes are seeing. As a result, even though the eyes are healthy, the brain isn't able to interpret visual signals correctly. Vision problems caused by stroke can be mild or severe, but any sudden change in vision should be taken seriously, especially in older adults. Don't assume it's just eye strain or tiredness. If someone suddenly can't see clearly, sees double, or loses vision in part of their visual field, it could be a stroke in progress. In such cases, call emergency services immediately. Acting fast can help protect the brain and reduce the risk of long-term damage. Number 4. Loss of balance or coordination. A sudden loss of balance, coordination, or body control is another serious warning sign of a stroke, especially in seniors. A person may suddenly feel dizzy, unsteady on their feet, or have trouble walking straight. Simple movements like standing up, turning around, or reaching for an object may become difficult or feel off balance. In some cases, the person may even fall without any clear reason. This happens because a stroke can affect the part of the brain that controls movement and coordination. When blood flow is interrupted in that area, the brain can't send proper signals to the muscles, which leads to a lack of physical control. If someone suddenly appears clumsy, stumbles while walking, or seems dizzy and off balance, especially if this happens along with other signs like slurred speech or arm weakness, it could be a sign of a stroke, not just fatigue or a simple trip. Don't wait to see if it goes away. Call emergency services immediately. Number 5. Severe headache without a known cause. A sudden, severe headache that comes out of nowhere, especially when there's no clear reason for it, can be a warning sign of a stroke, particularly a hemorrhagic stroke, which involves bleeding in the brain. This type of headache is often described as the worst headache of a person's life. It may come on very quickly and feel intense, sharp, or throbbing. Unlike a regular headache or migraine, this kind of pain usually doesn't improve with rest or medication, and may be accompanied by other symptoms like nausea, vomiting, dizziness, confusion, or even loss of consciousness. It's important not to ignore this symptom, especially in seniors. Many people make the mistake of thinking it's just stress or dehydration, but if the headache is sudden, intense, and unusual, it could mean that a blood vessel has burst or there is bleeding in the brain. If you or someone you're with experiences a headache like this, and especially if it's combined with other stroke symptoms like numbness, vision problems, or confusion, call emergency services immediately. Number 6. Facial drooping. Facial drooping is one of the most visible and well-known signs of a stroke. It usually happens on one side of the face and can appear very suddenly. A person experiencing this may find that one side of their mouth is drooping or they can't smile evenly. The affected side of the face may also feel numb or look flat and expressionless. A simple way to check for facial drooping is to ask the person to smile. If the smile is uneven or one corner of the mouth stays down, it could be a sign of a stroke. This occurs because a stroke can affect the muscles that control facial expressions, especially when the brain's blood supply is disrupted. It's important not to mistake this for tiredness or muscle weakness from another cause. Sudden facial drooping is a red flag. If you notice it, especially along with other stroke symptoms like slurred speech or arm weakness, take action immediately. Call emergency services without delay. Fast treatment can greatly reduce the risk of long-term damage. Recognizing the warning signs of a stroke like sudden numbness, confusion, vision problems, or facial drooping can truly save a life. Especially for seniors, every second counts. The faster a stroke is identified, the sooner treatment can begin, and the greater the chances of recovery with less damage to the brain. So, if you notice even one of these signs in yourself or someone else, don't wait. Call emergency services right away. Acting quickly can mean the difference between life and death, or between full recovery and long-term disability. If you found this video helpful, please give it a like, share it with friends and family, and subscribe to our channel for more important health tips focused on seniors and brain wellness. Your support helps us continue spreading life-saving information. As a brain doctor, I've seen many surprises, but this one truly shocked me. A single exercise that many seniors do every day could silently increase their risk of stroke overnight. And no, it's not an extreme workout. It's something most people think is totally safe. But before we dive into the details, make sure you hit that subscribe button and turn on notifications. But if you're over 60, your body reacts differently, and these 6 exercises could silently raise your risk of stroke, dizziness, or dangerous blood pressure changes. Number 1. Standing forward bend. Bending forward from a standing position may seem like one of the safest and most ordinary movements. Whether you're picking up your keys, tying your shoes, or stretching your back, it's something we all do without thinking. But here's the surprising truth for adults over 60, this simple action can quietly become dangerous. When you bend forward too quickly without proper support or body awareness, your blood pressure can drop suddenly, leading to a condition called orthostatic hypotension. This happens because gravity pulls blood away from your brain faster than your body can adjust, and that delay in circulation can cause dizziness, blurred vision, or even a sudden blackout. Many seniors don't even realize this is happening until it's too late. One moment you're bending down, the next, you're on the floor, unsure of what hit you. And if you lose balance and fall, especially if you hit your head, the risk of serious brain injury or stroke goes up dramatically. I've seen patients who suffered concussions, internal bleeding, and even hospitalizations from what started as a normal stretch or quick reach. A small movement, but a big consequence. The risk is even higher for seniors with high blood pressure, poor circulation, or those on medication that affects blood flow. These underlying conditions make your body even slower to react when posture suddenly changes. Unfortunately, many people ignore early warning signs like mild dizziness after bending, thinking it's just a fluke. But it's actually a red flag that your cardiovascular system is under stress. The good news is, preventing this is very simple. If you need to bend forward, always move slowly and intentionally. Start by planting your feet shoulder-width apart. Bend your knees gently to lower your center of gravity, and if possible, rest a hand on a stable surface like a chair, countertop, or wall. Give your body a few seconds to adjust and never rush. These few seconds can make all the difference in protecting your brain from sudden drops in oxygen and pressure. Remember, it's not about avoiding movement. It's about moving smarter. Being aware of how your body reacts to simple actions like bending is one of the easiest and most powerful ways to reduce your risk of stroke, falls, and serious injury as you age. Number 2. Lifting heavy weights. Strength training is often praised as one of the best ways to stay healthy and independent as we age, and that's absolutely true. But when done the wrong way, especially by adults over 60, lifting heavy weights can quietly turn from helpful to harmful. One of the biggest mistakes seniors make is lifting weights that are too heavy or holding their breath while lifting, a habit known as the Valsalva maneuver. While it may feel natural to hold your breath during a tough lift, doing so causes a rapid spike in pressure inside your chest and head. This sudden rise in blood pressure can place enormous strain on the blood vessels in your brain, and in some cases, it can trigger a stroke or a vessel rupture, particularly in those with existing hypertension or fragile arteries. Many seniors don't even realize they're putting themselves at risk. They may feel a sudden rush to the head, slight dizziness, or pressure in the chest during or after lifting, and dismiss it as fatigue. But what's really happening is a cardiovascular strain that the body may no longer be able to safely handle. I once met a retired firefighter who was in great shape, but during one heavy lift at the gym, he felt lightheaded and almost fainted. His doctor later explained that the blood pressure spike caused by holding his breath under strain could have caused a stroke if it had gone just a bit further. The danger increases when lifting is done without proper form, especially when trying to push limits or keep up with younger gym goers. But here's the good news: you can still lift weights safely and effectively. The key is to choose weights that are challenging but manageable, and most importantly, to breathe correctly throughout the movement. Exhale as you lift, inhale as you lower. This keeps blood pressure more stable and reduces stress on the brain and heart. If you're unsure about your form or breathing technique, don't hesitate to ask a qualified trainer who understands how aging bodies respond to exercise. It's not about lifting heavy, it's about lifting smart. Because the goal isn't just strength, it's longevity and safety. Number 3. Crunches and sit-ups. Crunches and sit-ups are often seen as good exercises for strengthening your belly muscles. But if you're over 60, these movements can quietly put you at risk, not just for back pain, but for something much more serious, a stroke. Here's how. When you do sit-ups or crunches, especially quickly or in large sets, you put a lot of pressure on your chest and abdomen. This internal pressure pushes upward toward your brain. If you also hold your breath during these movements, it makes things worse. This extra pressure can cause a sudden spike in blood pressure inside your head. For seniors with weaker or thinner blood vessels, something that naturally happens with age, this can be dangerous. In some cases, it can lead to a blood vessel bursting, or a stroke caused by bleeding in the brain. What makes this more risky is that during crunches, your head is also bent forward over and over again. That movement can put stress on the arteries in your neck, especially the carotid arteries, which send blood directly to your brain. Repeated pressure in this area may reduce blood flow or, in rare cases, cause a tear inside the artery. Both of these can also lead to stroke. Many people don't feel anything right away. But if you've ever had a headache, dizziness, or blurry vision after ab workouts, those might have been warning signs. Number 4. Squatting movements. Squats are often recommended to keep the legs and hips strong, especially as we get older. They help with standing up from chairs, climbing stairs, and keeping balance. But for seniors, doing fast or repeated squatting movements can actually put your brain at risk and, in some cases, increase the chance of having a stroke. Here's what happens. When you go from sitting to standing quickly or do squats too fast, your body experiences a sudden change in blood pressure. This is known as postural hypotension, which means your blood pressure drops quickly when you change position. For younger people, the body adjusts fast, but as we age, the blood vessels and heart may not react quickly enough. This sudden drop in pressure can cause less blood to reach the brain, even for just a few seconds, and that's enough to cause dizziness, fainting, or a fall. Why is this dangerous? Because if you fall and hit your head, that can cause a traumatic brain injury, which can lead to bleeding in the brain. One of the most serious types of strokes. Number 5. Rapid neck rotations. Turning or stretching your neck might seem like a good way to release tension, and many people do quick neck rolls or fast side-to-side movements without thinking twice. But for seniors, these rapid neck rotations can be far more dangerous than they appear. In fact, they can become a hidden trigger for a stroke. Inside your neck are two very important blood vessels called the vertebral arteries. These arteries carry blood to the back of your brain, the part that controls balance, coordination, and vital body functions. When you twist your neck too fast or forcefully, especially over and over again, you can accidentally pinch, stretch, or even tear these arteries. This reduces or blocks blood flow to the brain, which can cause a vertebrobasilar stroke, a serious type of stroke that affects the brainstem. What's scary is that many people don't feel anything at first. Some may just feel a little dizzy, off balance, or experience blurred vision. But in more severe cases, people have had strokes just minutes after doing a quick neck stretch. One report told of a man in his 60s who twisted his neck during a home stretch and had a stroke shortly after, all from a simple motion that didn't seem risky at all. Another danger is that neck arteries can weaken with age, so even small movements that were once safe in your 40s or 50s may no longer be safe in your 60s or 70s. If you already have high blood pressure, artery disease, or poor circulation, the risk is even higher. Move your head carefully from side to side, and avoid any jerking or snapping motions. If your neck feels stiff or tight, use a warm compress or speak to a physical therapist who understands senior health. The goal isn't to stop moving, it's to move in a way that protects your brain and arteries. Number 6. Long plank holds. Planks are often called one of the best full body exercises, and it's true. They can build strength in your arms, shoulders, core, and back. But for seniors, especially those with high blood pressure or heart problems, holding a plank for too long can put dangerous pressure on the body and even increase the risk of a stroke. Here's why. When you hold a plank, your muscles are working hard to keep your body still and balanced. That effort causes a buildup of pressure inside your chest and belly, especially if you're holding your breath at the same time. This internal pressure makes it harder for your heart to pump blood smoothly, and can cause a sudden spike in blood pressure, especially in the brain. If your blood vessels are already weakened from age, high blood pressure, or other health issues, this kind of pressure could lead to a blood vessel bursting in the brain, a stroke. Another risk is that many people forget to breathe during planks. Without even realizing it, they hold their breath to stay stiff and stable. This lack of oxygen can also cause dizziness, lightheadedness, or stress on the heart. One older woman I knew used to challenge herself by holding 2-minute planks every morning. Over time, she started experiencing tightness in her chest and headaches. Her doctor later told her that her blood pressure was spiking dangerously during those long holds. The good news is, you don't have to give up planks, you just need to do them safely. For seniors, it's better to hold a plank for 20 to 30 seconds at a time, take a short break, and focus on steady, deep breathing the entire time. You can also modify the plank by doing it on your knees or against a wall to reduce pressure while still getting the benefits. Remember, strength is important, but protecting your heart and brain is even more important. Choose exercises that challenge you without putting your health at risk. As we come to the end of this important video, here's what I want you to remember. Staying active is one of the best things you can do for your health, but only if you're doing it the right way. The goal after 60 isn't to push harder or follow intense routines. It's to move smarter, protect your brain, and keep your body strong without taking unnecessary risks. Many of the exercises we talked about today, like crunches, squats, heavy lifting, or quick stretches, might seem simple or harmless. But for seniors, they can quietly raise the risk of a stroke, a fall, or a serious injury. That doesn't mean you need to stop exercising. It just means you need to listen to your body, adjust your movements, and make safety your top priority. If this video helped you, or if you learned something new, please give it a thumbs up and share it with a friend or family member who may need to hear this too. And if you haven't already, hit the subscribe button and turn on the notification bell so you don't miss our videos. In this video, you're going to learn which sleeping position may raise stroke risk, especially in seniors, and what you should do instead to protect your brain and circulation while you sleep. We've researched stroke patterns, brain blood flow, and sleep studies for seniors, and this sleeping advice comes directly from clinical insights and neurology-backed data. These are the same tips doctors recommend to seniors with a history of high blood pressure, sleep apnea, or poor circulation. And today, you'll discover why back sleeping might actually be harmful for certain seniors. How to sleep to improve brain oxygen levels, and the one position most experts agree is the safest sleeping position to reduce stroke risk after age 60. Most people don't realize this, but strokes are more likely to happen in the early morning hours, especially between 6 a.m. and 12 p.m. This has a lot to do with something called your circadian rhythm, your body's internal clock that controls blood pressure and hormone levels while you sleep. According to studies published in journals like Stroke and the American Heart Association, blood pressure naturally rises just before waking up. This early morning spike in pressure can trigger a stroke in people who already have narrowed arteries or other risk factors. Seniors, in particular, are more vulnerable because their arteries may already be stiff or partially blocked, making these blood pressure changes more dangerous. When we sleep, especially if we're in one position for too long, blood flow slows down, and that can be risky for older adults. The body needs constant movement to keep the blood circulating properly, especially in the legs, neck, and brain. Seniors who may already suffer from poor circulation, diabetes, or limited mobility are at an even higher risk of developing blood clots during the night. According to research from the National Institute on Aging, being sedentary for long stretches even while sleeping can contribute to deep vein thrombosis, which can lead to stroke if the clot travels to the brain. That's why movement and good sleep posture are so important for overnight brain health. One of the biggest hidden dangers during sleep is sleep apnea, a condition where breathing repeatedly stops and starts during the night. This leads to drops in oxygen levels, which can be extremely harmful for the brain. Studies from Johns Hopkins Medicine and the Sleep Foundation show that seniors with untreated sleep apnea are 2 to 3 times more likely to have a stroke than those without it. The lack of oxygen puts extra stress on the heart and blood vessels, increasing the chance of clots and reducing brain function over time. Sadly, many older adults don't even realize they have sleep apnea, making it a silent risk factor for overnight strokes. If you snore loudly or wake up tired even after a full night's sleep, it might be worth getting checked. Number 1 position. Right side sleeping. Sleeping on your right side may feel natural and comfortable, but for many seniors, it can silently increase stroke risk. This position can cause the neck to tilt in a way that compresses the carotid arteries, the major blood vessels that carry blood to the brain. If these arteries are already narrowed due to age, high blood pressure, or plaque buildup, that compression can further reduce blood flow to the brain during the night. Over time, poor circulation while sleeping may contribute to an increased risk of stroke in seniors, especially if this position is used nightly. Number 2 position. Stomach sleeping. Sleeping on your stomach is considered one of the worst positions for both spinal alignment and brain circulation. When you lie on your stomach, you must turn your head sharply to one side to breathe. This extreme neck rotation can significantly compress both the carotid arteries and jugular veins, restricting blood flow to and from the brain. In seniors, this is especially dangerous because their blood vessels are often more fragile or partially blocked. Also, stomach sleeping can put pressure on the chest and diaphragm, making it harder to breathe smoothly, which may lower oxygen levels during the night. A hidden factor that may raise stroke risk while sleeping. Number 3 position. Back sleeping with poor pillow support. Back sleeping can be healthy for some, but only when done correctly. If you sleep on your back with a pillow that is too high or too low, it can throw your neck and airway out of alignment. This may worsen snoring or trigger sleep apnea, which causes repeated interruptions in breathing during sleep. When airflow to the brain is reduced, it leads to drops in oxygen, something that's closely linked to higher chances of stroke in seniors. Studies have shown that untreated sleep apnea doubles or even triples the risk of stroke, especially in people over 60. If you snore loudly or feel unrested in the morning, this sleeping position may be putting you at silent risk. For seniors, the wrong sleeping position may raise stroke risk more than most people realize. As we age, our arteries naturally become narrower, making it easier for blood flow to be restricted, especially when sleeping with the neck twisted or bent awkwardly. This is common during side or stomach sleeping, which can quietly reduce circulation to the brain overnight. In addition, many seniors deal with reduced mobility and undiagnosed blood pressure fluctuations, both of which make the body more vulnerable during sleep. If you have health conditions like atrial fibrillation, high blood pressure, or diabetes, poor sleep posture can further increase the risk of a stroke while sleeping. That's why sleep position isn't just about comfort, it's about protecting your brain and heart health as a senior. If you're wondering which sleeping position may reduce stroke risk, the answer is simple: left side sleeping. Experts often recommend this position for seniors because it offers multiple health benefits. Sleeping on your left side can help improve blood circulation to the brain, especially by avoiding pressure on the major arteries. It also helps reduce acid reflux and keeps your airways more open, which is important for smoother breathing during the night, a key factor in stroke prevention for seniors. Another safe option for some is back sleeping with your head slightly elevated. This position can help keep the neck and spine aligned and promote healthy blood flow, as long as you don't have sleep apnea. If sleep apnea is a concern, back sleeping might actually make it worse by blocking airflow. No matter which position you choose, it's important to use a cervical support pillow to keep your neck properly aligned, which reduces strain on the arteries and improves brain oxygen levels while you sleep. Along with choosing the right sleeping position to lower stroke risk, there are a few extra habits that can help protect your brain while you sleep. First, try to avoid heavy meals or alcohol before bedtime. Both can interfere with digestion and blood pressure, making sleep less restful and potentially increasing the chance of stroke in seniors. Another helpful tip is to elevate your head slightly, especially if you struggle with high blood pressure. This small adjustment supports better circulation and reduces pressure in the brain during the night. Also, try to keep a consistent sleep schedule. Irregular sleep patterns can throw off your body's rhythm and affect heart and brain health. Tonight, try adjusting your sleeping position. Even one small change could make a big difference in protecting your brain and lowering your stroke risk. If you found this information helpful, please share it with a loved one. You never know, it might just save their life. And don't forget to hit the subscribe button for more trusted senior health tips, including how to improve brain circulation, sleep safely, and live a longer, healthier life. In this video, you're going to learn about the most effective 1-minute stroke test for seniors that could literally save your life or the life of someone you love. Whether you're 60 or 85, this simple test can help you spot early stroke signs in elderly people before it's too late. We've spent hours researching the fast stroke test, a proven method trusted by neurologists and emergency doctors worldwide. It's the same stroke test we've seen used in hospitals, and the same one many stroke survivors over 60 credit with getting help in time. This isn't just theory, it's backed by real science and senior care professionals. And today, you're not only going to learn this 1-minute stroke test for seniors, but I'll also reveal a bonus hand strength check most people have never heard of used in early stroke detection. So make sure you watch till the end, because this could be the most important video you'll see this year for your health or your parents' safety. As we age, our risk of stroke increases significantly. Seniors, especially those over the age of 60, face a much higher likelihood of experiencing a stroke due to several factors such as high blood pressure, diabetes, high cholesterol, and limited physical activity. The blood vessels in older adults tend to harden or narrow over time, making it easier for clots to form and block blood flow to the brain. This is why it's so important to understand the early stroke signs in elderly individuals and to know how to perform a quick and reliable stroke test for seniors at home. In fact, strokes are the 5th leading cause of death and a leading cause of long-term disability, especially in people aged 60 and above. Taking preventive action and learning how to recognize stroke symptoms early can make all the difference between life and death, or between full recovery and permanent disability. One of the most trusted and widely recommended methods for detecting early stroke signs is the FAST test for stroke. It's a 1-minute stroke test for seniors that anyone can perform, no medical training needed. The word FAST stands for face, arms, speech, and time. Let's break it down. F stands for face. Ask the person to smile. Look closely. Does one side of their face droop or look uneven? Facial drooping is one of the most common stroke symptoms after 60 and should not be ignored. A stands for arms. Ask the person to raise both arms. Can they lift them equally? Or does one arm drift downward? Weakness or numbness in one arm is a key warning sign that the brain may not be sending signals properly. This is a critical indicator in stroke detection. S stands for speech. Ask them to repeat a simple sentence like, "Today is a sunny day." Are the words slurred, garbled, or completely incoherent? Trouble speaking clearly is often one of the first signs of stroke in elderly people. T stands for time. If you notice any of these signs, it's time to call 911 immediately. Don't wait. Every second counts when it comes to stroke treatment and survival. This stroke test for seniors takes less than a minute, but it can be the difference between timely medical care and a life-altering outcome. Encourage your loved ones to practice this regularly, especially if they have any stroke risk factors. To understand just how urgent stroke prevention is, let's look at the numbers. According to the CDC, someone in the United States has a stroke every 40 seconds. And every 3.5 minutes, someone dies from one. These are not just cold statistics, these are real people, often seniors over 60, who didn't get help in time. You may have heard stories of seniors who went to bed feeling fine and woke up unable to speak or move one side of their body. That's how fast and silently a stroke can strike. In many cases, the stroke could have been caught earlier if someone had done a simple 1-minute stroke test at home using the FAST method. That's why we're urging every senior citizen, caregiver, and family member watching this video To learn and regularly use this stroke test for seniors, because when a stroke strikes, time lost is brain lost. Now that you've learned the 1-minute stroke test for seniors, and don't keep this information to yourself, put it into practice today. Try this simple yet life-saving stroke test with your spouse, friend, or an elderly loved one. Even if they seem perfectly healthy, it's important to make this a part of your regular health routine. Knowing how to check for stroke at home can help you detect early signs before they become fatal. If you notice any of the warning signs we discussed, whether it's facial drooping, arm weakness, slurred speech, or sudden loss of grip strength, do not wait. Call 911 immediately. In stroke care, every minute matters, and getting help fast can prevent brain damage, disability, or even death. So please share this video with other seniors, caregivers, or family members who need to know this information. Let's work together to raise awareness, take action, and protect our senior community from stroke risks before it's too late.